Dendoo initial setup, Step 6, Therapeutic card, Orthodontic chart and creating a treatment. In this video, we'll walk through 3 key areas of a patient's clinical profile: the therapeutic card with all gum and dental status details, the orthodontic chart for treatment tracking and arch development, and finally, how to create a treatment record during a visit. We'll take a look at the patient's therapeutic card, one of the most detailed and advanced tools in Dendoo. It starts with the option to upload photos, intraoral, extraoral, X-rays or diagrams. We'll explain how to upload and manage them in the next video. Now to the therapeutic card itself. One important note: changes are saved only after selecting a specific date. Let's walk through the main features. The top section is for gum and root conditions: furcation, bleeding, plaque, calculus, erosion, gingival margin, pocket depth, and others. Switching between oral and vestibular views allows complete coverage of both sides. Each view has its own data, stored separately under the same record. Here you can mark conditions both on the roots and crowns of teeth. Each tooth is clickable, and you can assign specific statuses like composite, crown, extraction, implant, and more. Below, we see the crown zone, where visible conditions can be marked for both permanent and primary teeth. Blue numbers indicate baby teeth, black numbers, permanent. There's also a multi-selection mode for marking several areas at once. This works on desktop and tablet with gestures, mouse and keyboard combinations. The KPE index, or caries risk score, is automatically calculated based on the selected conditions. It's updated in real time and displayed at the bottom of the chart. Finally, there's a soft tissue and oral cancer screening block. This section allows detailed marking of any findings on the lips, palate, tongue, and lymph nodes. Responses are saved with each version of the chart and printed in the final report. One important note: changes are saved only after selecting a specific date. This is key to tracking progress over time. By adding a new record for each appointment, clinics can maintain a structured history of all updates, no overwritten data, full traceability. Speaking of printing, yes, you can download a full PDF version of the therapeutic chart, customized to your clinic's template. In upcoming videos, we'll show how to manage and adapt these templates to your local standards and language. Now let's move to the orthodontic chart. The first section is the extraoral evaluation. The most recent photos from the Patient Photo tab are automatically displayed here. If no photo has been uploaded, a placeholder icon is shown. You can enlarge the image and apply zoom to highlight specific zones during assessment. Below that is the NL angle, lips, and smile block. These are quick graphic markers used for visual classification. Any selection here is saved automatically, no need to press a Save button. Next is the occlusion and class block. Again, these images are pulled directly from the Patient Photo tab, from occlusion-related photo sections. This ensures consistency in documentation and eliminates repetitive uploads. Now we get into the crossbite and midline shift block. This is a powerful tool. You can place T-shaped markers on the upper and lower arches to indicate midline deviations, from -10 to +10. X markers are available to flag crossbites, and can be freely placed anywhere on the arches. Values between teeth can be entered directly into visible fields for precise midline measurements. All these visual markers are clickable and editable, and don't forget, changes here are saved automatically. Just below, you'll find several quantitative and diagnostic sections. Spacing and crowding. Overjet, overbite, curve of Spey and Wilson. TMJ, ATM, assessment including lateral movement, maximum opening, and joint noise. These fields combine graphic tools and numerical input to give a precise snapshot of orthodontic conditions. At the bottom, you'll see a block for uploading additional files or records. Detailed graphical controls for rotation, traction, and translation movements. A muscle palpation section, where pain or tension can be marked on each side of relevant muscle groups. And lastly, blocks for clinical conditions and general notes. The values you enter in the clinical conditions block will appear in the diagnosis classification report automatically. And remember, no save button is needed in the orthodontic chart. All input is saved as you work. Now that both the therapeutic and orthodontic records are complete, let's move to the final step, creating a treatment. To start, select the visit date and the doctor in charge, both fields are mandatory. Then choose the procedure from the list or switch to manipulation sets we've configured earlier. You can search by name or code, or filter by service section. Once added, each manipulation shows its full details, amount, treatment duration, tooth number, and surface. You can assign a diagnosis either to a specific tooth or to the full treatment. Dendoo lets you use predefined diagnostic codes or configure your own in the admin panel. Templates created in the previous video can also be applied here, just pick one and edit it on the fly. And if you don't want to type, simply use the voice input feature to dictate the treatment details. Now, about payment types. You can create treatments that are paid directly by the patient, or treatments billed to insurance. We'll cover how to manage insurance payments in a dedicated video soon. There's also the option to create treatment offers, proposals. You can generate multiple versions and send them to the patient by email, so they can review and choose the most suitable one. We'll also dive deeper into that process in an upcoming video. And finally, all treatments you create here become the base for payments. That's what we'll explore in upcoming videos.